Every 4.5 minutes, a child with birth defects is born. That's about 7.9 million children worldwide. My name is Lauren Lee, and this is the causes and effects of birth defects. A birth defect occurs while the child is still developing in the womb. This may affect organ function, physical appearance, or mental and physical development. Birth defects may be referred to as congenital disorders, congenital malformations, or congenital abnormalities. When I was researching this topic, I was thinking, what causes a birth defect? Birth defects are caused by multiple factors, including the surrounding environment, the health of the mother, and the genetic makeup of the child. The first factor that I mentioned is the surrounding environment. This can be broken down into about two categories: voluntary and involuntary factors. Voluntary factors are things that are purposely consumed. We refer to these things as teratogens. Teratogens are anything that causes malformation in the baby. Examples of voluntary factors are things such as alcohol, drugs, and smoking. Involuntary factors are agents that cannot be avoided. These are things such as secondhand exposure to smoke, radiation, and pollution. When a mother is pregnant, she should be very cautious of the environment she's in. This can greatly impact the baby. The next factor that I mentioned is genetics. Genetics can also be broken down into about two categories: single gene defects and chromosomal abnormalities. Single gene defects are mostly inherited. These are caused by specific genes. A few examples of single gene defects include sickle cell anemia and Tay-Sachs disease. Sickle cell anemia is mainly found in African Americans, people of Mediterranean descent, and Indians. The other category is chromosomal abnormalities. This is caused by a mutation in the DNA. Chromosomal abnormalities are your more commonly known birth defects. Examples of this are Pateau syndrome, Edwards syndrome, and the most common one of them all, Down syndrome. To give you an idea of how common Down syndrome is, about 1 in 800 babies are affected by it. Males are more likely to develop X-linked disorders because they have one X chromosome, whereas females have two. The last factor that I mentioned is the health of the mother. A mother's medical condition is vital to the health of the child. Before conception, things such as diet, vitamin intake, and glucose levels can have a long-term effect on the baby. Things such as obesity and diabetes increase the risk of having a child with a birth defect. There's a study by Drs. Zaharova and Lobo that says that young mothers have a 0.05% chance of having a child with Down syndrome. Mothers at the age of 40 have a 1% chance, and that chance jumps all the way to 8% for mothers at the age of 50 and above. Pregnancy should be a healthy and overall life-changing experience. By consulting a doctor, mothers can learn more about these causes and avoid these complications during pregnancy.